See, um, Oloshan,
Yes, good morning.
yes, it's Toby.
Okay.
Program. Yeah, I'll be making you host now. I need to start a new meeting.
I can see that Prof shared screen, so I don't know if
Yes.
she's around.
So I'll be making you host, and then I'll be back in a bit. Good luck.
Sorry, I didn't get that.
I'll be making you host now. I'll be back in a bit.
Okay, no problems. Hello, Prof. Good morning, ma.
Good morning, sir.
So, okay, I just want to confirm your availability, ma. So we are starting anytime soon, ma. So good morning, fellows, and good morning, Prof. Once again. So it's a privilege to have Professor Kudayo in our midst this morning, and should be taking us through qualitative research design. So it's time, ma. Please, over to you, Prof. Thank you, ma.
Thank you very much. Good morning, everyone. All right. Sorry, please bear with my network seems unstable.
Yeah, no problem, ma.
All right, so let me just share. It keeps going on and off. I guess I'm back. All right, so good morning once again, everyone. Thanks again for having me this week. I appreciate the organizers for loving me. All right, so this morning we'll be talking about qualitative research designs. I wish we could have a recap, but for this, I'm sure we promised that we're going to go over what we learned last week, think on them, ruminate, and then come back this week with questions. That would help us a lot. While my screen, I don't know if it's coming. Maybe I should send, please bear with me. Let me quickly send this slide to you because the other network keeps going on and off where I'm sharing from. I think, oh God. Dr. Kudus, Dr. Lawal, am I anywhere?
It's not
Hello?
on the call right now, ma.
Oh, okay. So who can I share my slide with so that I'm using two networks. I'm sharing my slide on my laptop and speaking on the phone, but the network on the laptop seem to be misbehaving. So please give me some minutes. Let me see what I can quickly do so that I
Okay.
don't waste our time. 2 minutes, please.
Okay, no problem, ma. Okay, fellows, sorry, as we await Prof. Uh, for our presentation, please, maybe if you have questions from the last session, you can drop them in the chat box now, please. So if you have any question from the last session, drop the question in the chat box, please. Hello, Prof. You can see your screen,
Well,
ma.
yeah, thank you. So now I'm back. I'm sorry for that each. So quickly, because I have about 38 slides to speak to, so I would rush in like 45 minutes so that we give room for questions and answers. So last week we talked about the forms of data collection, how data can be transcribed, translated, transcribed, and then imported, and the coding strategies that we can use. So we'll go over the heart of coding qualitative data. And this talks about the reliability and the validity of data and how transparency is needed. So the first is to note that qualitative research has a systematic process, and you must have heard or seen that since last week. So there's a process that is required to be followed, and then we must maintain consistency. There's a way, there are styles or steps that are expected over all your qualitative research work or study. And your process or whatever we are doing in our research must be consistent, must be repeatable. That is, if somebody else takes your work, you must give so much details that the person would be able to do almost or exactly what you did. Then your process must be believable. You can't say I went to heaven and I had my data collected or I went to the space, or a study of space. So I went to the space, or I spoke to aliens, or I spoke to angels. Your work must be believable. And now, when you have your data, how do you reduce your data from the big data to what is meaningful? Usually, we reduce by bringing out relevancy from the data, and then it must also be a transparent process. I talked about 3 coding strategies last week, or I mentioned it. So this week we'll quickly look at these 3 forms. We have the description focused coding strategy, we have the interpretation focused coding strategy, and lastly we have the presumption focused coding strategy. For the descriptive, just from the word or description, it means we seek to describe or identify things around us, experiences, phenomenon, um, settings, behavior, attitude. You just want to describe, and this would employ the question styles such as where, when, and who are questions that you ask. In this kind of coding, you do not need to interpret anything. You're just describing. And most times you code en vivo. When we say you code en vivo, means you code verbatim. You're just using the codes as said. So you're not giving your code's name, but you're giving your code names, but you're giving them names from what was coded. For instance, um, 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 you code as is being said, and you give that code that name, the description of said. So that's called en vivo. You are coding as it is being said. And for interpretation or interpretative focus coding, we are doing more than description. Just from the word, we are interpreting. So, and these questions such as how and why are asked here, or what you ask deeper questions. How do you mean? What are you doing? So you, as the person coding, now you're not asking these questions from your respondents. These are your own questions as you go into your interpretation or in your coding process. So you are going to be asking questions in your mind as you write, as you code, as you analyze your data. How? So how guides this interpretation process? And then lastly, the presumption coding. We do more than just describe and asking for interpretation here. We want to make references, we want to give solutions, we want to make conclusions with our coding process. So you want to give a solution, you want to propound a theory, you want to do more than just the linear format, which is the description. You want to do both ways. So you are going to bring both description and interpretative, and then you now do some presumption coding. You are giving a solution, you're propounding a theory, you're developing a model. That's when you do presumption coding strategy. Note that each of these coding strategy, if you are to teach them, you could take a class. So bear with me as I just give you tips. Now, these are like I mentioned last week, these are the research designs that exist. We have the phenomenological approach, the ethnographic approach, the narrative approach, case study, and grounded theory. So I take them one after the other. The phenomenological design talks about, usually the purpose for this is to examine participant experiences. You want to know why they experience what they experience. They're not just describing, but you want to know how, why. So you're examining, you're digging deep into the experiences of your participants. And usually the goal is to develop themes, you want to develop concepts that represent your participant experiences. And the coding strategies that are deployed when you want to do phenomenological research design are both descriptive and interpretative focus coding. So you're going to describe and also interpret. Now, let's quickly look at this example. How do individuals experience transition to parenthood? So, you're a first-time parent. It's important to know how So this researcher wants to know how you experience the transition to parenthood. So the questions that I would ask is, you want to delve deeply into the subjective experiences of the individual as they navigate the significant life transition of becoming parents. The emphasis will be capturing the essence of this experience and gaining a nuanced understanding of the phenomenon from the participant's perspective. So you want to, as you look at their experience, you want to gain an understanding of that experience. That is when you say we are doing a phenomenological approach. Note that the phenomenology here, or the phenomenon here that we want to understand, is transition to parenthood. So it's deeper than just describing, oh, okay, so when parents, you're not just describing the experience, you want to understand that experience. And that is when we do phenomenological approach. Now, when considering phenomena like homelessness, suicide ideation, rape, or educational training from the perspective of those who have experienced it, either directly or indirectly. This is another experience. It just has to do with a phenomenon, and you want to understand it. You don't just want to describe, but you want to explain it to people. You want to examine it. Then this is when you use phenomenological approach. It applies when we study a phenomenal experience by a group of people, when potential participants have or are experiencing the phenomenon. And lastly, when you expect people to discuss their experiences. So most times when we talk about lived experiences, because I know most of us are used to the word lived experiences when you read lots of qualitative research, you see that they talk about lived experiences. There and there, you notice that they do the phenomenological approach. Now, for the three types of phenomenological approach that we have the first one, which is the hermeneutic phenomenological approach. And this method is used to critically analyze written documents. From the word hermeneutics is from documents. So you are looking at documents such as Bible, diary, letters, case notes, hospital case notes, um, police reports, legal reports. Then you'll be doing the hermeneutic phenomenological approach, because you want to look at people's history, their context, their characteristics, and you want to extract some meanings or some understanding of their experiences. Then you have done the hermeneutic phenomenological approach. So the main thing here is that you are using written documents. You're not doing interviews. You're not doing focus group discussions. You're just going to be taking notes, documents to analyze. Now, the next is the interpretative phenomenological approach or analysis. And here, the emphasis is on the interpretation of participants' views on their experiences, considering factors such as participants' history, interviewing situation, and the researcher's biases when analyzing the data. Interpretative means that you're bringing more than what is said into the context. So you're bringing the physical context, the history. For instance, you're looking at their history from childhood to the point of your interview. You're looking at much more than what is said, but what is experienced, what you can see. You're bringing observation to view. You're bringing probably some documents together. You're looking at what their neighbors are saying. It's a lot more. Then you're telling us that you're bringing your own interpretation. You're bringing your own personal bias, because you're interested in, there's a conflict of interest. You're interested in the study that you're doing. You are not just interested as a researcher, but you have some interest in the study and you're willing to put in your own interpretation. Then it's called the interpretative phenomenological approach. So it allows for a bit of bias from your own experiences. Probably permit me to use this example. You are a survivor of rape, and then you are coming to ask, you are interested in rape, and then you want to ask people's experiences. You will not just be doing the phenomenological approach because you have an experience. You've been a survivor, so it's more going to be an interpretative analysis than just phenomenological. It comes with your own experience also. So then we'll be doing interpretative. For the transcendental phenomenological analysis or approach, you're going to collect, so it allows past experiences and presumption, and then you are telling us that you are going to be blocking your own consciousness. You're going to not allow your own life experiences, just as you have in interpretative, where you are allowing your own past experiences. But in transcendental, you're saying you are going to be you're going to suspend your emotions, you're going to block your emotions and stay aloof of the experience and just speak to the data. Then you'll be doing a transcendental phenomenological approach. And for the ethnography, like I said last week, is used more in social context when you want to understand people's dynamics, group dynamics, societal dynamics, cultural differences or cultural norms. Then you're doing a lot of ethnography, and here you want to develop concepts which around your participants' culture, their belief, their behavior, their practices, especially within a group. And most times you'll be using also the descriptive and the interpretative focus coding, just like you're going to be doing in quantitative, univariate, and bivariate. You might not be doing a lot of multivariate, just to let you understand what I mean. So you'll be doing a lot of um, descriptive and interpretative focused coding strategy. Now, an example here is how do employers in tech set up, experience, and navigate the organizational culture, collaboration, and work dynamics within the company. You want to understand their lived experiences. You want to understand to capture their interaction, their cultural nuances within that setup or within their tech company, and then you want to understand the workplace environment. Then you'll be doing the you'll be using ethnography. Now, for narrative approach, when we say you do, just from the word narrative, it means that you're just understanding or restating people's narratives, either chronologically or in order or based on some specific themes. So you're not doing so much when you do narratives. It's just from the word narrative, it's just to narrate. And basically, is the approach where you use just descriptive, because all you're doing is description. I'm just going to be describing what you have gathered from your data. And an example here is how do individuals narrate their experiences or of coping with stress in the workplace, and what meanings do they attribute to this coping strategy? You see that you're just going to be telling us what they said. There's no much to interpret. You state their nuances, you state their emotions, and you state their personal perspective. Just stating. That's what we do in narrative. Now, for grounded theory explains a process, a behavior, a phenomenon, or an event. And what it does is it seeks to develop statements or models or theory that helps us to understand the process, the behavior, or the event. And here we are using the three most times, but we use the descriptive, we use the interpretative, and we use the presumption focused strategy. So it's like doing a multi-level analysis. So you're doing all of it. You do the univariate, the multivariate, and then you do the bivariate, and then you move to the multivariate, where you can propound theories and give us models. An example that we have here is the investigation of nurse-patient communication. So look at the steps that we took to understand this. So you want to look at the verbal cues in their communication. You want to look at the non-verbal cues in their communication. You want to look at patient empowerment. How empowered do the patients feel when they communicate with the nurses? You want to analyze this comparison in these three. So at the end of the day, you might be able to propound theory to say, oh, when there is empathic communication promotes patient well-being. When you are empathic as a nurse with your patients, you might be promoting well-being. That's a theory or a model, a statement that goes beyond just explaining or goes beyond just describing. So usually the theory you want to emphasize, you use theory. Here you're propounding a theory based on what you saw that could build trust in communication and facilitate positive health outcomes between patients and nurses. So this is a table that helps us to understand it briefly, just to give us a brief table that once you have this table, you could easily find a place where you put yourself as a researcher. For the hermeneutic, obviously, is from a text. You're providing meaning of a text. So text that has been written. For interpretative, you want to assess participants' perspective of their experiences and interpret their views. For transcendental, you want to develop themes that reflect just the participants' experiences and determine the essence of their experiences in a bias-free state. So you are taking yourself off and then giving us a very bias-free state. But interpretative, you're allowed to bring your own biases from the term is expected because you have experiences. And then for ethnography, you want to understand issues in their natural setting, in their context, in their view. Do you want to understand the culture of nurses and doctors in the hospital? Maybe culture of communication, culture of relationship. Then you are doing ethnography study. For narrative, you just want to experience just state things in chronological order. For instance, it's like doing univariate. It's just basic, it's just descriptive. And then for case study and grounded theory, we develop things and want to propound solutions. Now, these are the type of software managers that we have. We have more than this, but these are some of them. We have the Atlas TI, like I mentioned last week. We have the Mass QDA, we have NVivo, we have DJUS, we have QDA Miner, we have Monkey Learn, and the likes. Now, let's quickly go into sampling strategy because these are important when we come concepts in qualitative research. So we have the purposive, the snowballing, the theoretical sampling, the maximum variation, we have the homogeneous sampling, the critical case sampling, we have the criterion sampling, and we have the quota. You note that most of these are non-probabilistic sampling strategy because we rarely would use random probabilistic sampling strategy in qualitative rather. So let's quickly look at the first one, which is a purposive. Of course, from the word purposive, it means that you select your participants based on experiences that of interest, especially if they have experience on what you want to ask from them, then you choose them. And then example is you want nurses that have at least 10 years of experience in preoperative care for cancer patients. So if you take a nurse that is 9 years, then you have not used this purposive sampling strategy. So your purposive sampling strategy tells you gives you room to select. You have your reason for selecting they are the experts and they are the ones that would be able to give you answers to your phenomenon of interest. So you seek them out and then you note that, okay, I'm going to any nurse that I meet who have this kind of experience are those that I would bring into my study. Then we have snowballing. Snowballing means that I I recruit my participants from their networks. There's a network, there's a group. For instance, you want to you have what can I use? What comes to mind? Experience of sexual minority in OAU. You want to study experiences of the sexual minors or minority in OAU. You can't. They don't have an association like obvious association, but you can link up, and then from your findings you get one person, and the one person tells you about the next person, links you to the next person. So it's like a network. You're going to use their network to get them. Oh, okay, so he's your partner. Oh, are you lesbian? Oh, thank you for coming out. She talks to you. She takes you to her partner. Her partner takes you to somebody who had it on her, and then like that, and like that, and like that, and then you get your sampling done. So that is snowballing. Then for theoretical sampling, this is commonly used in grounded theory, where you select participants based on emerging theories and category of from ongoing data analysis. Your sampling comes from your data, comes from your early data. For instance, you have done quantitative. It's from that data set that you are then coming to get your patients, to get them to. So that's a theoretical kind of sampling. Is your data that speaks told you these are people to interview, and these are people that are knowledgeable. Your data told you that this having looked through the first data set of your first experience, it guides you to this right set of people that would be able to give you your responses. For instance, you're interviewing patients with illnesses about their illnesses, then selecting caregivers from their data. That is how to. It's the those that you first interview that will give you those that you should interview next. So it's your data that guides what you would do. That's theoretical sampling. And then we move to the maximum variation sampling. These are participants with diverse experience to capture a very wide range of perspective. Example is selecting diabetes patients from different centers with different treatment regimen. You it's a very the variation. For instance, diabetes varies in its own type, and aside that, what is used varies. The drug varies, the type of treatment varies. So because it's a very large population, and you want to capture all of these um, types or sets or differences in your work, then you will have to look at the different and then find a way of capturing all of the diverse experience in your sampling procedure. And then the selection is you move from center to center to make sure that you have both the type 1 and the type 2. And then aside the type 1, you're grouping them based on the type of disease, you're grouping them based on the type of drugs they use, or maybe for those who have moved into insulin, so you have a variation of how to choose, and then you have to make sure that all of that are taken care of, especially because it's a vast society. So that is maximum variation sampling. Then we have the homogeneous sampling. Homogeneous is you have you're selecting participants with similar characteristics to focus on a particular subgroup. So it's a very dicey way. For instance, well, you want to interview resident doctors from Uniben. They must be from Uniben, from University of Benin, but they must be doing their residency in OAU teaching hospital. Obviously, that's very homogeneous, very, very small sample size or population rather, but that they must have exact same experience. Then you'll be doing homogeneous sampling, because it's assumed that doctors who were trained at Uniben and then that are coming to do their residency in OAU or UI would have almost exact same experience, almost. Then that's homogeneous sampling. Now we have the critical case sampling, where you choose your cases that are particular particularly from have importance to your research question. It's a critical case, for instance, Ebola or an experience. Okay, let me use the example I have here. Selecting hospital that successfully manage and contain an Ebola outbreak with no staff fatality or secondary infection. It's a critical case. It's not common. It's not not an experience that you find every time. Something that is very unique. Then it's critical. It's critical case sampling that would be used. Then we have the criterion sampling. Participants are selected based on predefined criteria. Example is exploring the experiences of primary care physicians in managing patients with chronic diseases. You know that you can't just choose anybody because you want to look at primary care physicians, you want to look at the chronic diseases. So you have to look at, and the main thing that you would, because those your respondents here are the physicians. So you have to look at what you need in those physicians. For instance, what's their profession? What area of medicine are they specialized in? Their years of experience, their patient load, how many patients do they have, and the work setting. You remember it's primary care, so you have to be very specific. So it's guided by the criteria that you select. Then we have the quartile sampling. Here this involves selecting participants to ensure representation from different subgroups within the population. Example is you're trying to understand how different demographic groups experience and perceive telemedicine in rural settings using age, gender, and existing health condition. This it's a subgroup within a population, and you note that you have to look at age, you have to look at gender, you have to look at their existing health condition. Then that's a quota. You are using them to represent. They are making sure that each of these age, gender, and existing health condition exists in your sample. And now choosing how do we choose the right sampling strategy? I'm sure most of us will be thinking, oh, with all of this, hey, God, how do I then know the right one to choose? Well, this is the right time to listen. So what guides our choice of sampling strategy is research. Number one, our research question. What does your research question seek to do? Does it seek to um explain? Does it seek to know how? Does it seek to know what? Does it seek to know where, when, why? That matters. Then also, what's your population? You note that the differences in all of these styles or this strategy has to do with the population itself. What is the size, the diversity of your population? And then what resources have you? Your resources has to do with your time. How much time do you have? What's your budget? Um what's your financial strength and your access to participants? So please note that none of this is fixed. You as a researcher can find a way around which of these that best suits your time, your budget, and your access to participants. You note that some of these sampling strategies seem easier, sounds easier, and more straightforward than the other. Then you don't necessarily have to hurt yourself in your own research. So note your research question, your population characteristics, and your own resources matters in your choice of selecting sampling strategy. What are the sampling size determination? What determines your sample size? Also, it has to do with your research question, your diversity of perspective. How much of perspective do you need in your research? And then your resources matters also. And lastly, but most importantly, is your data saturation. So we would explain data saturation further. What is data saturation? At what point, as a researcher, do I know or do I note that my data is saturated? What do we mean by data saturation? Here I said it's a critical concept in quantitative research, and is a critical concept in qualitative research is data saturation, where collecting more data does not yield new insight or information. What it means is the more you go to the field and you ask your question, there's a point, especially if you're doing it by yourself, there's a point you get to that you know that your participants are beginning to say exactly the same thing or almost same thing. Then you know you have gotten to your point of data saturation. Your participants, there's nothing new anymore, nothing interesting, nothing, no new information is given to you anymore. Then you have gotten to your point of data saturation. The sample size is sufficient when this point is reached. Usually, once you have your population well defined, and you start, for instance, you're interested from one of the examples in diabetes, and then or caregiving, care, you want to ask caregivers about their burden, and you started asking questions about, oh, so how do you see it? The first person spoke to you male, second person spoke to you female, um third person, like that you've done, and then maybe by the time you are getting to your 15th, just an assumption, I'm not saying that is when you get to saturation. You could be getting to your saturation from 10. You might not get to your saturation until you do like 20 something. But by the time your participants are beginning to say exact same thing, or they are beginning to sound so similar in their thoughts, then you have gotten to your point of data saturation. And that's when you do not need to go to the field anymore. So quickly, we'll move to sample size or sampling size. What is the ideal sample size? This is very controversial when we speak in, or when we have discourse in qualitative research. What is the sample size? Can you predetermine your sample size from home? Do you get to the field to determine your sample size? Note that now that you're under a supervisor, or you are learning, um listen to what your supervisor or your guide has to say. But usually, it's expected that the field should speak to you. Is the field, just from what I just explained, when it comes to data saturation, it's expected that you are on the field until you get to the point of data saturation. But sometimes, based on time constraints, based on funds, based on your access to participants, you might have to come back from the field quickly or earlier than you plan. So there are no cast in stone numbers, or there are no determining or sample size calculators when it comes to qualitative, as you have in quantitative, where you can determine, you can use some formulas to determine your sample size. In qualitative, you do not, you really would be able to determine your sample size. But sometimes from literature, you can get a clue. If you have read, you've reviewed your literature, and then literature had told you that, oh, okay, so the first person whose work you read said he or she got to the point of saturation by the 15th, or on the 15th participant. Second person you read said about same thing. Third person, and then you read 10, 20 persons, and they're saying, oh, they interviewed 20 persons, maximum 20 persons. Then you know that there's a tendency that you could predetermine your sample size based on literature, what others have said. Okay, I'm assuming that by the time I'm getting to the 15th person, I'll be getting to my point of data saturation. Then that can be a guide to your determinant. So for all of the data collection method, the interview, observation, focus group discussion, and data document analysis, these are things that could guide your sample size. Thank you very much. I think I rushed so much that I have 2 minutes left from what I planned to say. Over to you for questions. Thank
Thank
you.
you so much. Thank you so much, Prof. Really enjoyed the session. You've really impacted us with knowledge. And to the fellows, I know it might look somehow, to be sincere with you also, during our own cohort session last year, some of us had the same issue, but when we went back to visit the material and also the video, we understand better. And I must say this at this point, there's also office hour for this. So any of your topics that you are finding difficult to understand, so office hour is there for you. So, and also please take note of the software manager, because Prof. Ekundai also advised us last year that we should play with the software manager, and I was able to play with Atlas TI, and it really helps a lot. So please, any of the software manager that you think you can cope with, just go online and play with any of them, please. Now it's time for questions. So any question from the session, please go ahead and ask. You can raise your virtual hand or in the chat box. Prof. Ma, there is a particular question before you join back the other timer.
Okay.
Yeah, the person said, "Good morning. Please, I would like to find out, in qualitative studies, do you need a theoretical framework?"
Excellent question, and thanks for that. Do you need theoretical framework? Not exactly. Not as strictly as you do in quantitative. What we use theories for is when you want to start your engagement with your data, like you want to start um, discussing your data, and you have a strong theory that guides. For instance, what can I use? Let's use the biopsychosocial model, for instance. It has guided your thoughts. It has guided your understanding of the study, especially when you want to do a mixed method. So it has guided your understanding, it has guided your thoughts, and is guiding your ways of looking at your response, not necessarily your response, but asking your questions. Now, by the time you come back and you want to start on giving your discussion, it should guide your discussion, because you want to start from the bio, then move to the cycle before you move to the social. So it could guide your analysis, it could guide your thoughts, but it doesn't necessarily guide it strictly as we do in quantitative, where it just must follow the model. No. Remember, for qualitative, the king is the respondent, not your own preconceived ideas. Your data set is your Lord and Savior. Permit me to use that word. Your data, or what your respondent has said, will be the cocoa of the discourse. So if you think that now bringing your data set into your biopsychosocial model would enrich it, will enrich your discourse, will enrich your understanding, why not? You understand? So it depends, but it doesn't guide you strictly. It's not a strict way as much as quantitative would do. But we use theories too. Of course, theories are facts that has been stated again and again, and that you could find in most society. So theories are not anti-qualitative, neither are they, but they guide us, but not as strictly as you would do in quantitative. I hope that makes sense, or you understand it
Uh,
a bit more.
so thanks for the answer, ma. Thanks for the response. We're grateful. Any other question from the fellows? You can raise your virtual hand, or you can just input it in the chat box.
Someone's
Um,
hand.
okay. I can't see it from my end. So the person
That's
Yeah,
just
you
go
can
on.
unmute.
Yeah, the person should go on. Okay.
You can
I think I
unmute.
can.
Okay, ma. Good morning, ma. Thank you so much for the session. I have two questions, ma. One is, um, from the phenomenon, that's the analysis, we have both the interpretative, the hermeneutic, and sorry for the pronunciation. But my question is about it is, what are the ethical boundaries? For instance, the one that the hermeneutic, which you have to look at documentaries, diaries, and all that. What are the boundaries? Are there things that maybe how to guide your work on with that pattern of analysis? Are there boundaries or guidelines that, so that if another person is looking at it, you can this work properly done, or this work is ethically done, and all that? That's the first question. Then the second question is, from all we've been learning so far from the beginning of this training, is actually overwhelming. I know part of the reasons is because it's like most of it for me, it's like my first time. I know with time I will get to understand the concept better. So I want to ask, is there any way, maybe if someone wants to do a research, must the person be the one to do everything from the beginning of the research to the end? Is it ethically or is it ethically wrong for maybe from one portion of the research, or maybe in an analysis, or in a part of the research or the manuscript, to delegate someone to help the person to do it? For instance, all the softwares you have to learn and use, and all those things can be overwhelming. So that's my question. If it's possible to maybe delegate, if it's right to do so, and what are the boundaries around it? Thank you so much, ma.
Thank you so much. Beautiful, intelligent question. So I'll start from the last question. It's important to know all of this. If you do not know them, or you do not know your own onions, how do you ascertain that if you take somebody on, the person has done the right thing? So I wouldn't encourage you to start employing people. Yes, it's overwhelming. It sounds very stressful, but I tell you that as you go on, it's not as stressful as it sounds. It sounds stressful because it's like so much, like you said, so much to take in, and then so the research that I see has this much component in it. That's why it sounds this overwhelming and this stressful. Is it not stressful? It is stressful. But is it a good stress? Yes. It's important for you to know all of this, learn the software yourself, learn to be on the field, learn how to do your interviews, learn how to do your analysis, learn how to do your own report writing, learn how to draft your own interview guide, learn how to, it's important. But can you employ people to do? Yes, you can. But how do you, if you do not know, how would you know if the person you employed has done the right thing? I've said this several times. I've had to help organizations find ways around their data sets, because sometimes sometimes we had to go back to the field to do some interviews again, because the persons that were employed to do interview didn't do the interviews well. Imagine you paid so much to your research assistant, and you have employed wrong persons because you do not even know what it takes or entails to do an interview. So you ask them, do you know how to do an interview? They say yes. Oh, do you have experience? Yes. You don't know what an interview should sound like or look like. So you employ them, they go to the field, all for your money. They collect your money, your resources, your hard earned money. They take it from you and then bring bad data. You do not even know. Your translator and transcribers have done their work. You have gone to the field, you've paid your analyst, he has done the analysis, but there's nothing in the data. And they come back to you and tell you, ma or sir, the data that you have do not actually speak to what, it does not even have anything in it. How heartbreaking would that be? So, but if you knew what should guide what should be, by the time they are coming back from the field and bringing their data to you, you can check and know whether they've done the right thing or not. If you take on an analyst, you can guide the analyst. When you speak, the person knows that this person knows. So he or she cannot do nonsense, can't do any wrong thing for you, can't do any wrong analysis. because by the time you're speaking, he knows you know. So it sounds overwhelming, but please bear it and learn. Learn. It doesn't have to be a day. I'm speaking to you. I didn't learn this in a day. I started learning and learning, reading, picking up these, playing with Atlas AI, like your the person Sheung said, and then I started, and then again and again, and I got better. Read books, bought books, traveled, went for trainings, and here I am today. So it takes time, but you don't have to do all of it alone. You can employ people. Then to the first question, how do you know you're doing the right thing? Note that, like I said when I was explaining one of the concepts, the coding strategy, that coding strategy in itself is something you could teach for an hour. Semiotic analysis, semiotic phenomenological analysis is something you could teach for an hour. So it's like giving a summary of a year's program or a year's training to you in 2 weeks. There's no way we'll go over all of it. But as you read again and again, you understand the process. The process isn't cumbersome. It's obvious. How do you know you're doing the right thing? All of these approaches would require that you take all of the things that you learned last week to the end of today together, would make a meiotic phenomenological approach. For instance, it starts with your data collection. How do you know the right data for a meiotic? A meiotic is text. So how do you know the Bible? For instance, you want to do biblical text on um concubinage. You want to write a paper on diseases, the care of diseases in Old Testament, and then you want to use Leviticus and Numbers. How diseases are, probably leprosy is treated in the Bible, and then you want to use Leviticus and Numbers. How do you know the right? What guides your choice of Leviticus and Numbers? You understand? So that's your population is your Bible or your Old Testament. Your sampling will come down to Leviticus and Numbers, probably purposive to say that those were the times where instructions were given on how to care for a leprous person. I'm not sure it's Leviticus. I'm just saying all of this from my head, but I'm assuming I'm right. So then, have you come to Leviticus and Numbers? Now you've read your your text. How do you start to code Leviticus and Numbers? Do you start with inductive or deductive? Are you going with some themes to your Leviticus and Numbers? Are you going to just read the whole of Leviticus and Numbers and do the inductive? So it's all of the things that you learned from last week to now that guides the whole of this, just this strategy, just this sampling, this phenomenological approach. I hope that makes sense. You're not doing interview, you're doing data document analysis. Now, if you were going to do the transcendental or interpretative phenomenological analysis, then you have to also take it from the beginning to the end, to the point of analysis and even your report writing. How do you write your report? Are you going to write it thematically? Are you going to write it by objectives? So it's a lot, but it's not that difficult. It's just because you're hearing all of this for the first time. Just like I advised last year, continue to play with all of this. Read more articles, read papers on qualitative, pick up people's papers, pick books and read. The more you read, the more you see, the more you know. Thank you. Over to you.
Thank you so much, Ma. We have one other question, Ma. Okay, the person says, please, what is the role of Clark and Brown in qualitative analysis, and how efficient can the students use it, Ma?
Okay, thank you very much. Beautiful question. Clark and Brown gives steps onto how to take your process, and anyone could. They are not the only ones that give process or steps that guide analysis. there are other persons, or there are other theories, there are other methods or styles. So, but for them, if you choose to follow them, you could as a student, and there's nothing wrong in following some steps on your qualitative analysis. So feel free, please. Note, we keep reading and reading and reading. And the more we read, the more we know. Thank you.
Thank you so much, ma'am. We are really grateful. Dr. Kudus, sir.
Yes, thank you very much. I just felt I should appeal for the session as usual. Thank you very much. And also to thank you. I was listening to you and I was like, it's time for me to retire. You did it and did it very well. Thank you very much. And the students, thanks for being around. I know I got some messages, but it's fine. We have a good number of people attending. So, we'll get back to all of the WhatsApp and for your data allowance, spend as uh, sorry about the delay for the last one. And thank you everyone. And you have a lovely weekend.
Okay, to the fellows, is a wrap on today's edition of the session. Okay, someone raised then. Sorry, someone. Okay, sorry. Once again, it's a wrap on today's session. So thank you for your time, and to Professor Kundayo, thank you once again, ma. We are really grateful, and to everybody, have a lovely weekend. Thank you. Mr. Toby.